The kidneys process 150 quarts of blood daily, maintaining plasma osmolarity and electrolyte balance. They also produce critical hormones like erythropoietin.
The kidneys are purplish-brown organs, connected to the bladder. Internally, they have an outer cortex and an inner medulla, with renal pyramids and collecting ducts, the calyces, exiting through the ureter.
The nephron is the kidney's functional unit. It begins at the renal corpuscle, where a highly selective 3-layer sieve filters water while retaining larger molecules. Filtrate enters the proximal tubule. It passes to the loop of Henle. It descends into the medulla and ascends back to the cortex, the final site for modification. Deep within the renal cortex lies the renal corpuscle, the site of blood filtration. Here, podocytes wrap around capillaries to filter plasma, leaving vital proteins behind in the blood.
Within the kidney's renal cortex lies the proximal convoluted tubule. Lined with Simple's dense brush maximizes surface area. This allows for the bulk reabsorption of water, ions, and nutrients.
The thin descending limb is highly permeable to water. Lined by simple squamous epithelium, water is reabsorbed by a strong osmotic gradient.
Within the renal cortex, the distal convoluted tubule fine-tunes our electrolytes and acid-base balance.
The collecting duct travels from the cortex to the medulla. Its lining changes from cuboidal to columnar cells. Here, ADH regulates the final water recovery.
Renal function involves 3 core processes: filtration, reabsorption, and secretion. This maintains plasma homeostasis. The proximal tubule reabsorbs most filtered water. The driving force is the sodium gradient, maintained by the baselolateral sodium-potassium pump. Sodium enters PCT cells through various transporters. In the S1 segment, the NHE3 antiporter reabsorbs sodium. Water follows these solutes via osmosis. The loop of Henle creates a concentrated gradient. The descending limb is permeable only to water. The ascending limb actively reabsorbs solutes. This preserves the medullary osmotic gradient. The DCT and collecting duct make final urine adjustments. Here, PTH regulates calcium reabsorption. ADH triggers aquaporins for water reabsorption. Aldosterone promotes sodium and potassium balance.
Renal health assessment relies on biochemical markers. Since early kidney disease is asymptomatic, screening is vital. The common method evaluates eGFR. This uses serum creatinine levels, influenced by age, sex, and diet. This leads to inaccuracies in GFR estimation. Equations like CKD-eGFR. Cystatin C is an alternative marker. It is not affected by muscle mass. Ultrasound is the preferred first-line modality. It is ideal for evaluating kidney size and cysts. However, CT is better for detecting small stones. B is the gold standard for stones. Low-dose protocols have significantly reduced radiation risk. MRI is limited in severe renal impairment. Nuclear scans like MAG3 and DM offer functional insights.
DMSA scans detect cortical scarring. MAG3 scans assess flow and drainage, useful for evaluating obstructions.
Nuclear medicine scans offer functional insights, such as the MAG3 renogram, and DMSA scan.
A MAG3 scan assesses flow and drainage. DMSA scans detect cortical scarring. Various processes cause renal disorders. Understanding mechanisms is paramount.
Chronic kidney disease is a gradual loss of function. Diabetes and hypertension are its primary drivers. High glucose and pressure damage glomerular capillaries. This triggers a cycle that elevates systemic blood pressure. PKD causes fluid-filled cysts to grow. They enlarge, displacing healthy tissue. This can lead to pain and hypertension. Ultrasound is used for diagnosis.
Kidney stones form when substances like calcium and uric acid crystallize. They cause severe, agonizing pain, known as renal colic as they pass. Larger stones may require laser treatments.
When eGFR falls below 15, blood externally, using a machine as an artificial kidney, with effective options for home use. Peritoneal dialysis uses the abdomen's own membrane to filter out waste.
PD offers flexibility, but its effectiveness may decrease. Kidney transplants offer a better quality of life. They show significantly lower mortality rates. It requires lifelong therapy.
Xenotransplantation is making rapid progress. Using kidneys from genetically engineered pigs, these clinical trials offer hope for the global organ shortage.
We're starting the treatment now. Your vitals look great today. Want to naturally detox your kidneys? Start with pure lemon-infused water. Add antioxidant-rich berries to your diet and enjoy herbal teas like Your Body Will Thank You.